Arthritis of the knee, or osteoarthritis of the knee, is probably one of the most painful and most common degenerative processes in your knee. It's typically referred to as wear and tear arthritis. It typically happens over time as we get older. Sometimes we have a genetic history of it, sometimes we have an injury, but our knees just eventually start wearing out. When the knees wear out, the meniscus can tear, you lose cartilage on the end of the bone spaces or the bones get closer together. We refer to this as being bone on bone, and many times the bone will actually grow spurs that become very painful. Surgical treatment for knee osteoarthritis involves replacing your knee. Typically during this procedure, it is an open procedure. We can do it robotically assisted as well, which involves us using small cameras throughout the operating room to perform a computerized image of your knee, to actually simulate the surgery on a computer screen, and then actually perform the surgery just right after that. To replace your knee, we actually use specialized surgical tools, saws, and drills to remove the very end of the bone, which removes all of the arthritis. We then cap those ends of the bone with metal implants and usually put a plastic spacer between them. We also typically put a plastic spacer on the underside of your kneecap as well. Total knee replacement surgery is very successful at minimizing your pain and sometimes completely alleviating it. Most of all, we want to improve your function and your quality of life with your knee replacement.